The long spine of the Andes mountain range reaches down the length of South America. The signature of the region, the Andes create a landscape of extremes. High snow-capped peaks, arid coastlines, and dense tropical rainforests. The Andean countries, which in the past have shared the glory of the greatest civilizations in South America, today also share in a growing economic crisis which has reached disastrous proportions over the last decade. Development has virtually ground to a halt. The health sector in particular is overwhelmed by the magnitude of the problems. Marginal groups, the urban and rural poor, mothers and children, and the elderly, suffer the most. In response to these challenges, Bolivia, Colombia, Ecuador, Peru, and Venezuela have joined together in a collaborative effort to bring better health to the people of the Andean region. With support and coordination from the Pan American Health Organization, they have developed a plan called the Andean Cooperation in Health. Here in the highlands, customs and traditions have remained very much the same since ancient times. Corn and the native potato were cultivated then as they are today. But for these farmers, it is almost impossible to survive in the current economic climate. Millions have deserted the rural farms to seek a living in the cities. Today, over 70% of the population in Latin America lives in urban centers. And the numbers continue to grow. As more and more people crowd into the vast slums, the problems of violence, unemployment, hunger, and pollution worsen. Andean cities are increasingly strained to provide basic services, adequate housing, clean water, sanitation, education, and safety from crime. Children are some of the most tragic victims. For many, the urban slums have been a dead end to poverty and despair. Under a combination of social and economic pressures, families begin to break down, and children are drawn to the streets. This woman directs an urban center for homeless minors. Tonight, like many other nights, she ventures into dangerous neighborhoods to help the children who live on the streets, trying to survive any way they can, by begging, stealing, or prostitution.
Just look at your eye, honey. You can't go around like that. You're going to lose that eye. Let's go. I promised I'd take care of you.
They get high by inhaling solvents, such as terracal, or by freebasing cocaine. Mama Lucha, as she is known to the children, tries to persuade this boy to leave the streets to get medical help.
You're sick, you know. That's why I came to get you. I don't care if you stay out on the streets, but take care of yourself or you're going to die. You're in bad shape, you know. You can't keep going around like that. Generally, they're kids that have been abandoned. A lot of them have families, but it's as though they didn't have any. So they're kids who live on the streets. Generally, they run into bad company, crime, drugs, prostitution, homosexuality. Rehabilitation rates are very low. Low because, unfortunately, our resources are limited. But usually the kid who finds shelter in our house or our home feels relief from the things he finds on the streets. You work a lot and you accomplish a little, but the little you accomplish makes it worthwhile to keep on working. Did you smoke a joint or sniff glue today? You've really messed yourself up, you know. With the disease you got, you really messed yourself up. What do you mean it doesn't matter? You want to die, huh? Come on, for your own sake, you dummy. I've been told you're bleeding from the rectum, right? Aren't you?
These are primarily social problems, but they have a negative impact on health, and they are becoming increasingly common throughout the Andean region. Yet, as the economic situation continues to worsen, fewer resources are available for drug treatment and prevention and other necessary health programs. All sectors of the health system have been depleted by years of economic troubles. This mental hospital, like many other healthcare centers in the region, is deteriorating from lack of funds. But broken windows and peeling paint are nothing compared to the human suffering here. Without money for adequate treatment and care, these patients endure subhuman conditions with little hope for the future. The economics are harsh. When there is less money to spend on health care, the poor are the first to suffer, especially mothers, children, and the elderly. Poor children pay the highest price. Malnutrition, acute respiratory infections, and diarrhea are everyday problems throughout the Andean countries. Many die from preventable diseases, and even more are disabled for life. Here in the tropical lowlands, people face an additional threat: vector-borne diseases. Millions of people are at risk. Again, the problem is related to poverty, precarious housing, poor sanitation, and displacement. This healthcare worker is trained to help. Native to the area, he travels to remote settlements to provide sorely needed malaria tests and antimalarial medicines. This entire family tested positive. Children are most debilitated by malaria, as they have little resistance to the disease. Healthcare workers like this one are essential to the widespread availability of primary health care. Much of the Andean region lies along the Pacific Ring of Fire. Natural disasters, earthquakes, volcanic eruptions, and floods have always plagued the region. When volcanic mudslides engulfed the town of Armero in Colombia in 1985, Providing assistance to tens of thousands of victims proved a difficult task for the already overburdened health sector. Disaster preparedness and well-organized international cooperation is critical during this kind of emergency. The affected community also rallies to help its neighbors, offering food, shelter, clothing, or just sympathy for those who have been hurt, left homeless, or have suffered the loss of a loved one. Even in less extreme times, community participation makes a big difference. The traditional and natural concern for health at the community level is common to all the societies of the region.
Pancito, ¿me están pidiendo? No hay pancito. Después va a haber pancito. Ya vamos a...
In this Andean village, local women participate in a milk program and vaccination campaign, which is administered by a grassroots organization, the People's Committee for Health.
The mothers here collaborate, as you can see. They're always here when you call them. They come to work. They help with the vaccination, which is the main thing. We vaccinate all children under 3 years of age, and all of the children are immunized. This is the work of the People's Committee for Health. We make people more aware of health, so we can make the necessary progress.
We think that only if we are organized, aware, and well educated in community participation, then we can say that the right to health is not sold, it's not bought, it's not given away, but rather it's conquered through community organization, and this community is determined to fight for its health.
Through cooperation, self-sufficiency within the region is possible. For example, by developing regional pharmaceutical industries and by procuring drugs in a coordinated fashion, the quality of medicines can be assured, and they can be made available at reasonable prices in ways that are practical and culturally acceptable to the user. Effective traditional medicines must be identified as well, for large numbers of Andeans continue to depend on traditional healers. In some areas, over 70% of the population is born in the hands of traditional midwives. The integration of these healers into the system as trained primary health care workers will extend the reach and effectiveness of the healthcare system. Reducing needless deaths and bringing better health to the Andean countries will be no easy task. It will require dedication, coordination, and resources. The Andean cooperation in health will mobilize the political will and available resources within the region. It will speed up joint actions among the countries to resolve common health problems in priority areas and promote efficiency in order to obtain maximum impact. No country is independent in matters of health. Each depends on the situation and actions of the others. By making a commitment to work together, the Andean nations will make the objectives of this initiative a reality, and thereby dramatically improve the health of the people of the Andean region.